Welcome back to our De-Escalation series. In this video, we're going to talk about trauma-informed care. You may have heard this term before. However, we're going to take a closer look about what trauma-informed care is and how we can prevent an individual from escalating. What is trauma? Trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening. Trauma has lasting adverse effects on the individual's functioning and well-being. Individuals who have experienced trauma can exhibit its effect in many ways. History of trauma can result in a hypersensitive stress response. The fight, flight, or freeze mechanism is more easily triggered in an individual with a history of trauma, which places these individuals at an increased risk of escalating behavior. Additionally, these people can also exhibit emotional dysregulation, problems with interpersonal skills, problems with relationships, and destructive choices. What is trauma-informed care, or TIC? Realizing and recognizing that many individuals have experienced traumatic events directly or indirectly that have influenced their physical, emotional, social, or spiritual health. Responding by taking a universal approach to caring for every patient as though they are survivors of trauma and implementing practices to promote safety, respect, and trust to avoid re-traumatizing. Emotional trauma is one of the most unrecognized, undiagnosed, and unreported forms of trauma. Unfortunately, many of our inherent practices here at the hospital can be triggering and re-traumatizing, including removal of clothing, lack of privacy or a closed door, feeling of pain or physical touch, vulnerable physical positions, powerlessness over situation, feeling pushed to do something with no choice. Additionally, the hospital environment itself can be triggering, such as noise levels and sounds, smells, crowded areas, feeling trapped, restrictive visitor policies, waiting, not knowing what will happen next, and individuals that are cared for by people wearing masks. 6 principles of trauma-informed care: empowerment, choice, collaboration, safety, trustworthiness, and recognition of cultural and historical and gender issues. How can we use trauma-informed practices? Common courtesy. Knock before entering the patient's room or before pulling back the curtain. Introduce yourself and your role in every patient interaction. Ask the person their preferred name and/or pronoun. Use open and non-threatening body positions. Ask to raise the bed or sit down so that you and the patient are on the same level. Protect privacy. Recognize and be sensitive to the fact that the questions we ask are often personal, intimate, and intrusive. Be aware of others in the room. Implement barriers such as curtains and be mindful of your vocal volume. Try and keep the patient from overexposure whenever possible. Keep private areas of their body covered as much as possible when performing assessments or exams. Promote safety. Let the patient know that they can tell you to stop or give you an agreed upon signal to stop at any time during an exam or procedure. Discuss whether or not there is someone they would like to have with them during procedures or discussions with the care team. Provide information and support. Promote choice and encourage asking questions. Let the patient know what to expect on your shift. Information about lab draws, tests, Meals, dressing changes, physical therapy, activities of daily living, and anticipated doctor rounding are some examples. Provide choices whenever possible. For example, physical therapy before or after the activities of daily living. Use plain language and avoid medical terminology. Know your audience. Ask permission to perform various tasks, especially those that involve touching the person. Explain the reason for the action and any anticipated sensations they may experience, even a blood pressure assessment. Be observant. Look for changes in the patient's verbal and nonverbal behavior that could indicate discomfort or fear. A person who appears distant or not responsive to questions may be disassociating. When people disassociate, they become less aware of their surroundings or situation. Reduced awareness is a way to cope with triggers in the environment. Thanks for watching. If you have any questions, please contact an educator.